Hello everyone, I hope you all are well and enjoying your weekend. So today I'm back with the series Is Sun Good For Me? And today is episode 2. We are going to talk about vitamin D. It's a quick thing just to continue with the first episode where I started touching a bit of a vitamin D anyway. So most of the questions people have asked, I'm going to answer through this talk. I'm not going to answer separately. So I'll just sum up. The questions mainly were the daily requirement of vitamin D and how they can pick and choose, what type of food is good, and what happens if you don't have enough vitamin D, and why you develop vitamin D deficiency once you've kind of seen your doctor and you've had a treatment, and then after some time you get the test done and it kind of drops again. So most of the questions are around vitamin D, which I'm going to touch that anyway today. Okay, just bear with me 1 second. So let's talk about vitamin D. So as I've mentioned, the series is about the sun. So I'm a very positive person and I focus mainly on the positivities first. Then we talk about the negative things. So moving forward, we will talk about, the bad effects of sun and how we can protect as well. So during that talk, I will be touching a lot of the your kind of daily skin care regime, and I'm going to be touching the SPFs and things as well. So what is vitamin D and why it's important? So vitamin D is one of the essential vitamins. Why it's important is because it helps with the bone strength, formation, and stability. So that's why you need to kind of make sure that you have enough vitamin D, because otherwise your bones will kind of not grow the way it's meant to be. Along with that, if you see, I just want you to visualize a little bit about bones. So if you see that bones are the main kind of structure, they build the structure of the human body. So on the bones, there are attached muscles and then other, structures as well. So if the bones are not powerful, you will have problems with the muscles as well at some point. So which simply sometimes means muscles aches and pains. So vitamin D deficiency can give you aches and pains generalized. You can feel tired as well because it kind of works a little bit on the powerhouse as well. So the natural symptoms you get is tiredness is one of the commonest symptoms. So when, for example, if I'm seeing a patient in my clinic where I'm kind of have done all the workup and I'm unable to find a reason of tiredness, the first I have to check vitamin D levels. It causes a lot of lethargy, and I've seen a lot of patients with headaches, and I've seen a lot of patients with headaches. Sometimes actually, I've seen patients getting really ill just purely they had low vitamin D and they couldn't cope. So other kind of conditions, like when we talk about ME, we talk about chronic fatigue syndrome, or these type of things where you feel that you're exhausted, your energy, you're struggling to keep the energy levels. That's the point. Other than, yes, many other vitamins are there, which we will talk about it, but purely today. So in that situation, just make sure that your vitamin D levels are actually right. So that's the key to it. And these are the symptoms you get. Now, certain other conditions, say for example, if you are pregnant, you're breastfeeding, then you need extra vitamin D as well. Plus, if you're going through any illness, so vitamin D is something you absorb through sun. As soon as the sunlight touches your skin, that initiate the process of vitamin D absorption. So that's why it's important. Now, certain things you have to be careful that if you are somebody with a darker skin color, or you're Asian, South Asian, American, or you are African, you're not going to absorb the vitamin D or the sunlight how other people, the lighter skin color, they will. So that is a little bit of a downside of people of my skin color and the skin color darker than me. And that's why vitamin D deficiency is more common in darker skin people. So it's not then because especially many people, when they live in countries which are really sunny, like Pakistan, India, Spain, and all of these countries where there's a lot of sun, you struggle to explain this to them, that the sunlight which is there, they're not still absorbing the sun. So that's one of the other reasons of the genetics of the color you keep, which can affect the absorption of vitamin D. That's one thing. The other thing is people who are, so let's talk about who is at a high risk to develop vitamin D deficiency. So people who work indoors, who sit in the offices, they're at a high risk. However, you are absorbing a bit of sunlight anyway, but that contact time is not enough for you to let the sun strike your skin and actually start the process. So yes, you're at a high risk. Then if you're struggling, or if you're somebody who is already having a chronic health condition, and chronic health condition does not mean that you have to be old to have a long-standing health condition. It means anything which can affect your immunity, your immune system, or your muscles, or your bones, you are at a high risk. Also, people who are like elderly, they stay indoors and they prefer not to go out. They're at a high risk to have this problem. Then, especially if you are in UK, the milk, most of the cow's milk in UK, it's not fortified. So if you are having a milk which is not fortified, you're not absorbing that from the milk. So many people, they then feel that because they've had this milk, so they have absorbed a lot of calcium and other things through that. It does not work that way. So it has to be a fortified thing. So plus if in COVID, at the moment, because there's not enough evidence to kind of suggest that this is 100% evidence-based. However, we have seen that because in COVID you develop inflammation in the muscles, and if you have a low vitamin D, that can cause a lot of muscle aches and pains. So the COVID symptoms are going to get worse. So it's important to make sure that, especially during this time, you're just taking extra vitamin D. That will help. And or if you're struggling, you get COVID, or anybody just inform. They have to increase a little bit of their vitamin D daily requirement. Is a little bit different. So that's what it is. The guidelines here, we suggest 10 micrograms. Now I will tell in a second how to kind of compare, because there were so many questions about the micrograms and the units that people were sending me pictures. They were just kind of to the Skinzo, that is this the daily requirement which they struggle to understand. So I will touch that in a second. Now the food, let's talk about food. So it is common, it is present in oily fish. So salmon is a very good source of it. It is also present in red meat. Now you have to be careful, because if you are struggling with conditions like gout, then a lot of red meat is not good for you. So you're not going to have that. It is also present in more spreads, fat, the spreads which are kind of quite fatty based. It's also present in the breakfast cereals and things. So egg yolk is the highest, contains a lot of vitamin D. So somebody like me, I like more on the low carb stuff. So I don't eat a lot of red meat. So if you see that way, then I'm going to struggle having a lot of dietary intake of vitamin D. Plus, I've already mentioned the sun, looking at my skin color, then going out. I'm not going to absorb a lot of, sunlight anyway. So this means somebody like me is at a high risk to have low vitamin D. And you can then compare yourself according to the things which I've mentioned right now. So let's cut the story short. So this means that the only vitamin I take, I have a very good balanced diet. The only vitamin I take is actually vitamin D. So just feel free and take that. There is a of course a bit of a safe range that you shouldn't be overdosing yourself, because what happens is that vitamin D increases the absorption of calcium, phosphate, and a few other things in your body. We don't want a lot of calcium in your body as well. So this is an important thing, that many people, when they go and buy vitamin D, most of the vitamin D, there are different companies, they form differently, but many, I think about 90%, they actually form vitamin D and calcium together. So we have to be extremely careful with the calcium in your body as well, because extra calcium is not good for your bones, it's not good for your muscles, and not good for your heart. Plus, it's going to have a knock-on effect on your kidneys. So a condition called hypercalcemia is actually quite a bit of a medical emergency as well. Of course, the amount you're having outside, you're not going to have a lot, but there is no need to buy extra calcium if your calcium content is right in your body. I do not recommend that at all. So, because I see people just go and they literally buy extra calcium and they just, or the multivitamin. So again, the multivitamin bottles, if you're having, and it says vitamin D, you need to make sure how much the dose is present there. So the daily requirement of vitamin D is anything between 400 to 800 units, or we say 10 microgram is a daily requirement. Now, how do you so 1 microgram is like 40 units. So it just literally comes in either a microgram or a unit. So if you're having that, if you're going for 10 microgram, you're having approximately 400 units. The daily requirement is like from 400 to 800 units. It's important to keep it a little bit to the higher of the normal range rather than having less of vitamin D. As long as you're not having like more than 4,000 units a day, you're safe. It's, the overdose needs a very big dose. So that's the safest zone. And that actually answers about 10 questions where people were stuck. Which company? Forget about the company. Just go and buy simple vitamin D. You don't have to pay... you don't have to pay a lot of money to go for fancy, vitamins and things like that. So I'll pick up this question in a second. So that's about the daily requirement. Now, you have to be careful in how much is the daily requirement for adults and in the children. So babies under 1 year of age, their daily requirement of vitamin D is different. And that's about 8.5 to 10 micrograms. Now, it's similar to that, but what I'm trying to say here is that many people, they opt for vitamin D supplements for the kids. That's perfectly fine. The only thing you have to be careful that if they are on the formula milk, then most of the formula milk it's fortified, so it's added vitamin D content there. We don't want to overdose babies with vitamin D as well. That's the thing you need to be careful. Then as they grow, it's the same requirement, which is for the adult. Now, how many times I can have fish in a week? Well, you can have as many times as you want. Somebody like me, I tend to in 7 days, I eat fish like, 4 days minimum to 5 days as well. You can have fish depending on what type of fish you're going for as well. But even then, the absorption is a little bit less. So you still have to make sure that the extra, like I have fish and egg daily. Not daily, egg definitely daily I have it. But if you add that, still the amount usually is quite less. So that's how you just need to kind of make up and calculate your own. So that's an answer to you, Fahad. Now, what else? So we have done that. The other thing is that when you are going through process of stress, I've already discussed how that affects. So that can cause a lot of lethargy, tiredness anyway. So dose yourself up a little bit on the vitamin D. It actually will help. So we've done that. What else is left? So I've already mentioned a lot of that. Okay, so few of the things is about vitamin D that I tried to explain that in the last video as well. That the contact time, which people struggled, and there were like 5-10 questions purely about the contact time. Now, contact time, I did say that it means it's the contact. So if you break down, it means the contact of your skin to the sun outside. That's, in simple words, what the contact time means. Now, when you're going out, you don't have to stay out. Like people go and sit for hours. You don't have to do that. That will burn your skin, because when we are talking about the UVB, UVA, and other, kind of a breakdown of the UV light, it works and absorbs differently through your skin. So UVB is the main thing which actually kind of works and starts starts this vitamin D synthesis process. So as soon as you're going out, that's touching that. So it's already touched your skin. and it started the process. So maximum within like 15 minutes, 10 to 15 minutes, even if you're going out for a brisk walk or a run or whatever, that is enough time for that is enough contact time. And it's done the trick. And I did mention that in the last video that if you're going out, you are having a similar contact time, yes, but that does not mean that if you're going out like 10 times a day, you actually have absorbed, because you can't see how much the sun you have absorbed and how much you're covered as well. So like somebody like me, I'm quite covered up, so I'm not gonna my contact time of the bare skin to the sun is quite less as compared to somebody who is not covered it up. So there are multiple factors involved in the contact time. That was what I was trying to say last time. Similarly, when you're going for the sun, these lamps and tans and things, they don't increase your vitamin D absorption synthesis. So that's something totally different. So many people feel that they've gone on a tan bed and they've, bought these fancy lamps and things, and that is going to increase their vitamin. That's not actually going to increase the vitamin D synthesis. So don't kind of fall into that trap. Just make it very simple. You're going out, you've absorbed vitamin D. That's not enough. You need more vitamin D. Just get a supplement, have vitamin D, take maximum vitamin D through your diet. The diet factors I've already mentioned. If you suffer with any illnesses or when it's dark, like the maximum time of vitamin D synthesis is during the summertime. And if you live in the countries like UK, we hardly see sun here. So of course my contact time would be far less than anybody else. But similarly, if you're living in Pakistan, then most of the time you're not actually out. You're sitting indoors as well. So that will still affect the contact time. Okay. What else? So that's I've already touched all of these things. The only other thing is that when you're going out for holidays, when there is sunny areas, that does not increase again further the contact time. So if you're sat there for like 5 hours or 6 hours, the contact time of the synthesis is still the same, initial 15 minutes maximum. You've got it. It's done the trick. Now, depending on the real skin of you, so depending on your genetics, the skin type, the color, the tone, the strength, and how good you've looked after your skin, where exactly you're sat, that will then it may initiate a different process, which means that then you need to be careful. There is UVA as well. So that is then going to affect, so it can burn the skin. That's the reason people coming back from holidays, sunny holidays, they have inflammation, they have redness, they feel the skin is quite sensitive to touch, to light, because the contact time, they have passed that. And then it's the burning time of the sun where we say sun is not good for us. So that's the sun is good for us, then sun is not good for us. And that's the contact time is really, really important to understand. So I hope I've conveyed the message. And if you still have any questions about contact time, get back to me. And I'm happy then to kind of, I'll try to kind of pick that spiral again in the next video. Okay. What else? So I've already mentioned about the COVID and the vitamin D intake. We've mentioned about what people, I'm just going through the, if there is any questions left which I've not answered. I've already mentioned about the formula milk, social home, and everything. I think that's all. I've kind of covered most of this stuff. So I've picked most of the questions there as well. So that's enough for today. I don't want to linger on. It's a weekend. Have fun, and I think there's another live tomorrow. I'm not sure which one is it. I have to check, but I will see you tomorrow, and until then, have a very good weekend.